Unleash the power of knowledge and connect with the heartbeat of the African diaspora. Download our African Diaspora News Channel app now on Google Play and Apple App Store. Stay informed with authentic and diverse perspectives, breaking news, and cultural insights. Immerse yourself in a community that celebrates unity, resilience, and progress. Experience the vibrancy of the diaspora at your fingertips. Don't miss out. Empower your perspective today. Search African Diaspora News Channel and join the conversation.
Hey everyone, Rosemarie Havsom back again to help you take full control of your life by what you choose to put at the end of your fork. So let's get into it. It's happening. It is the time of the year for the Senate hearing. We have Robert Kennedy Jr. being absolutely grilled by the Senate in the Senate hearing to see if he's worthy of being the person to be in charge of making America healthy again.
News reports have claimed that I'm anti-vaccine or anti-industry. I am neither. I am pro-safety.
Well, it started off with a bit of a bang with interruptions from protesters, but hear what Robert F. Kennedy Jr. had to say about what he sees as the most important thing for the health platform that will help Americans in 2025 and going forward. Take a look at this clip and we'll be right back to talk about it.
If you buy McDonald's French fries in our country, there's 11 ingredients, my understanding. In Europe, there's only 3. If you buy Fruit Loops in our country, they're loaded with food dyes, with yellow dye, red dye, blue dye, and many other ingredients. The same company makes the same product with different ingredients for Canada and Europe. And at age, we don't have good science on all these things. And that is deliberate. That's a deliberate choice not to study the things that are truly making us sick, that are not only contributing to chronic disease, but to mortalities from infectious disease. We need to get a handle on this because if we don't, it's an existential threat. Our country is not going to be destroyed because we get the marginal tax rate wrong or because we get one of these culture war issues that we've been talking about today wrong. It's going to be destroyed if we continue down this trajectory of chronic disease. We need to fix our food supply, and that's the number one.
He's not wrong. Robert Kennedy Jr. is not wrong in his observations about how healthcare has been going in the United States. We're seeing more and more people becoming obese and morbidly obese. And unfortunately, Black people in the United States, African Americans and Caribbean Black people and Black people in general are still falling short when it comes to their health and wellness. We're seeing that obesity and trends in obesity and morbid obesity are affecting Black people more than any other racial group. Another thing that we're seeing is the fact that the SNAP program that's supposed to help people to have a supplemental nutrition assistance is actually not really doing what it claims to be doing. More than 25% of the $112 billion that has been put into the SNAP program has gone into buying of junk food and soft drinks and ultra-processed foods. What is going on? If the government is actually funding nutrition supplements for people who are below the poverty line or just half of the poverty line, then what are we saying? We're seeing an influx, a rise in the poor nutrition of Americans at large, and especially when it comes to African Americans and Black Americans in general. We are seeing more malnutritioned, obese people with high blood pressure, type 2 diabetes, and high cholesterol. And why is that happening? It's happening because the food choices are not good ones. And when you have low income with EBT cards that can buy anything in the store, and the first choice or the majority of the choice is going towards junk food and ultra processed foods and soda and other sugary beverages, we see a problem in that it's increasing the instance of overweight obesity and morbid obesity. Now, how can we stem that? Robert F. Kennedy Jr. had some ideas about how to prevent this from going on. He's talking about some things that are considered to be very radical, which is cutting the subsidy to farmers and cutting back on the kinds of foods that can be available for your EBT card or for people that are on SNAP programs. It's really not going well, as we can see here. Take a look at this clip and we'll
Federal
be right back.
funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugar drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware. But I don't want to take food away from anybody. If you like a cheeseburger, a McDonald's cheeseburger, a Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on your health.
He's been nominated. He has the endorsement of the President of the United States. So he definitely will be the person in charge of overhauling the healthcare system of the United States. And we're hopeful that it can do good for the Black community. But here's something that I also want to emphasize, and that is something that Robert F. Kennedy Jr. spoke about too. It's about health outcomes. And that's what I've been saying for so long, that my tagline of your health depends on what you choose to put at the end of your fork. And if at the end of your fork is not real food and it's not nutritious food, then you are signing your own demise certificate for poor health and early demise. Medicaid and Medicare, RFK Jr. is saying that these two programs need to be overhauled in order to make sure that the emphasis is now put on Americans being responsible for their health care and not just eating foods that are not real foods that are causing a lot of these preventable chronic illnesses and then having to rely on Medicaid and Medicare to solve the problem. We all need to take responsibility for ourselves and what we eat. And as African Americans and Black people in general in the United States, we have to remember that you are your own advocate. You have to make sure that you are doing what you need to do for your body to remain healthy so that you can live a healthy and happy life. Life is not going to be fulfilling if you have to rely on medication for preventable chronic illnesses for the rest of your life. With all of the side effects that come into play with them, that can be worse than the issue that the medications are supposed to be treating, that is not quality of life. That is not a good quality of life. And we have to really take a hard look at what we're doing to ourselves and to our children and what kind of legacy we're leaving behind. It's going to be an interesting fight to see how we can make America healthy again. But I'm really looking at what RFK Jr. has in store. It's going to be interesting, but it's like anything. It's like having to rip off a Band-Aid to avoid the long-term pain. We need to change from what we've become used to, and we have to retrain our taste buds and our discipline. And sometimes radical change is what's needed. What do you think? Comment below if you think that this is the right way to go with RFK Jr. and his stance on how to improve healthcare in America, and what questions you might have about it. And don't forget to like, share, subscribe to this channel. Check out my YouTube channel, which is Havsom, H-A-V for Victor, S-O-M for Mother. We'll see you next time. Have a good one. Bye.